Hi, my name's Brianna. I'll be your nurse today. We're going to do a head-to-toe assessment. Can you just verify your name and date of birth for me?
Elena Nicole Murray, September 13th, 2003.
Okay, good. Okay, Elena, and what's your height and weight?
5 foot, 112 pounds.
Okay, very good. And then, Elena, we're just going to do your vitals really quick before we get into everything. So this is going to be your pulse ox reading. And while we're doing that, I'll get 99. We'll get your blood pressure. Do you have any wind restrictions? Okay. And you can just try to relax your arm. All right, good. That's 105/70. Okay, and then we'll take your temperature. Okay, very good. All right, and then I'll just get your pulse reading really quick. And a normal pulse rate for an adult is between 60 to around 100 beats per minute. All right, Elena, so now we're gonna start with the head-to-toe assessment. I'm just palpating your head to feel for any masses, checking your hair, making sure there's no infestations or redness or hair patch loss. Everything looks good. Okay, now we're just looking at your face, checking for symmetry, if there's any drooping, which I don't see. All right, so now we'll test some of your facial nerves. Can you squeeze your eyes closed? Good. Can you smile, frown, and puff out your cheeks? Very good. Okay, so now we're just gonna palpate for your temporal artery. And then this is your TMJ. Can you bite down for me? Very good. And open again. Open. Yes. And then can you try to open against resistance? Very good. Okay. And now we're just going to palpate your sinuses. So we'll feel, is there any tenderness?
No.
Okay. Very good. All right. Now we'll move on to your eyes. So again, just looking, there's no swelling, redness, or yellowing. There's no leakage. So everything looks good. And then we're gonna check some other cranial nerves. So just follow the pen light for me. We're checking in the 6 fields of vision. Okay, very good. Now follow it into your nose. Okay, very good. All right, and now I'm just gonna check for your pupils to see if they are equal and reactive to light. Okay. Good. Okay, so they are both equally dilated and reactive to light. Alright, now we're going to check your ears. First, I'm going to inspect, look to make sure everything looks okay. Is there any pain or issues with your ears?
No.
Okay. Very good. And then we're going to palpate the mastoid process. And everything feels equal and symmetrical. Now, I'm going to whisper 2 words on either side of your ear and either side of your head, and you're just going to tell me what you hear, okay?
Yellow and green.
Okay.
Banana cake.
Very good. Okay. Now we're just going to do your nose. So I'm just going to take my pen light, look up. Seems to be no inflammation, no leakage, everything looks good. Have you had any problems with your nose lately?
No.
Okay. So close one nostril for me, take a deep breath in and an exhale. Good, and the other. Any issues?
No.
Okay, very good. And it sounded like a deep, thorough inhale and exhale. Alright, so now we'll move on to your mouth. Just looking at your lips, they're nice and pink. There's no cyanosis or discoloration. Everything looks hydrated, no signs of dehydration. Can you open your mouth for me and stick out your tongue and move it side to side and lift it up for me all the way up? Okay, doesn't look like there's any masses underneath the tongue. And then I would take a, what are those called?
Depressor.
Push down your tongue and check to see if the gums look good, if they're red. And then can you stick your tongue out and say "ah" for me?
Ah.
Okay, and then the uvula looks good, it's centered. And now I'm just gonna check for your swallow for me. Okay, everything looks good and it looks centered. Okay, now we're gonna move on to your neck. Can you look side to side for me? Good, and up and down. Any issues? And can you shrug one ear to the other and push up against my shoulders? Good. Or, you know what I mean. Alright, so now we're gonna palpate your lymph nodes and just feel to make sure we don't feel any swelling. And I don't feel any swelling. Okay, and now we're just gonna check your coronary artery on each side, but you can't do it bilaterally, so do it one at a time. Okay, very good. Okay, so those are both equal. Very good. Alright, next we'll check your upper extremities. So we're going to check for your radial pulses first. And while I'm doing this, I can also look at both of your arms for symmetry, lesions, and any discolorization. Everything looks good. Pulses are both equal. Alright, next I can check for skin turgor. This will tell me if you have any dehydration, which you don't, and we can check capillary refill. Very good. Okay. And then can you wiggle your hands for me? Good. And squeeze my fingers. Good. And then can you push against my hands? Very good. Alright. Next we'll move on to your chest. So we would start with inspection and then also take for your heart sounds and then lung sounds. So move your hair back. Doesn't look like there is any redness. Have you had any issues with your chest lately?
No.
Okay. So right now we're doing heart sounds. And then we're gonna do your apical, which is gonna be a full minute. And then again, a normal heart rate for an adult is between 60 and 100. So next we're gonna do your lung sounds. So we're gonna start with the apex of each lung. So inhale through your mouth for me. Okay. Again. Okay. Okay. And one more time. Okay, and then I'm just gonna check mid-axillary line. Go ahead. Okay, and on this side. Go ahead. Okay, now I'm gonna check the lung sounds from behind, okay? Thank you. Go ahead. Okay. All right. Go ahead. And last one. Okay. So there was no signs of carpals, wheezing, stridor, or anything abnormal. So that's good. Next we'll do your abdominal. So if you want to lay back. Okay. Have you had any issues with your stomach lately?
No.
Okay, very good. So first is inspection. Everything looks good. Umbilicus is center. So next we're gonna see next would be auscultation, but first I just want to ask you some questions. When was your last bowel movement?
12 p.m.
Today. Okay. And do you have any issues urinating?
No.
And when was your last menstrual cycle?
April 16th.
Okay. Alright, so now we're gonna listen in all quadrants for bowel sounds. Okay. 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 So you have normal active bowel sounds. And then we're going to palpate. So we'll start with soft palpation. Any tenderness?
No.
Okay, and then we'll do deep palpation. Any tenderness? Okay. Alright, so you can put your shirt down. And then we'll check your lower extremities. This will have to do. Alright, so first I'm just going to lift your leg to test your range of motion. Any discomfort with that?
No.
Okay. Any issues with range of motion or anything with your legs lately?
No.
Okay. So I'm just feeling for symmetry and swelling. Everything seems good. Knees are good. There seems to be no edema, which is good. Alright, and then check your toes for any discolorization, fungi. Everything looks good. And then we'll check your pulses. So let me see if I can get your popliteal pulse. Okay. Okay, so we feel equal, and then we'll do tibial. Okay. Alright, so everything is equal. And then we would check capillary refill, but I won't be able to tell with your nail. Okay, so we just check capillary refill if you didn't have nail polish on. Alright, so we already checked for range of motion. Can you try to push down on the gas pedal? Good, and then flex them towards you. Very good, and wiggle your toes. Okay, good. And then we're gonna check for Babinski's reflex. And your toes curl in, which is good. Good. Alright, and then you can sit up, and then we're just gonna inspect your back if you can stand for me for scoliosis. Alright, so first check your even, very good. And then I'll lift your back, and if you could lean all the way down for me. Alright, and there's no S-curve, so everything looks good. And you're all set. Thank you.